All right, let's get started. I'd like to welcome you all to this Advocacy Boot Camp Luncheon on behalf of our chair, course chair, Dr. Ross Goldberg and myself. And over the course of today, what we really want is to hear more from people out in the audience out there about their experiences with advocacy and about their kind of viewpoints on advocacy. So I'm going to start off with a talk that is entitled Importance of Physician Advocacy. And so I will give you my disclosures. I am currently located in Indiana as a member of the faculty, and I'm an alumnus of Wisconsin, this close to being national champions in basketball this year. And I work as an advisor to Cook Biotech meeting 3 times a year for their medical advisory board. But probably more importantly is I am the converted. I already find that advocacy is important. I am not politically aligned with a party, but I am the legislative committee chair for SAGES. I am also the legislative committee chair for the College of Surgeons. I have attended the Advocacy Summit with the American College of Surgeons, which starts on Monday. The leadership event starts tomorrow in Washington, D.C. As the chair of the committee, legislative committee for the college, I'm on their health policy advisory group. I've donated to the PAC, not as much as my co-chair here for the course as Dr. Goldberg, but I commit a monthly contribution to our Surgeons PAC, and I have contributed to candidates in the past, and in the last cycle I committed money to 4 different candidates, some federal and some state within the state of Indiana. So obviously I'm speaking from the choir to all of you. So what is advocacy? And of course it's important to start off understanding what advocacy is. Sometimes people don't understand completely what the topic means. And so first of all, it involves identifying an issue, and that could include researching it, that could include generating an analysis of it. And from that, you might find that the issue requires legislation. Just like the Schoolhouse Rock, I'm Just a Bill segment, it may require somebody bringing that idea toward an elected official to create legislation. Litigation can also represent advocacy, not necessarily broad sweeping advocacy, but it can generate an important precedent in how certain issues are addressed within our legal system. And of course, advocacy, as most of us identify it, involves networking frequently with legislative officials or people that are connected to legislative officials or the parties within our political system. So examples here, it could include, for example, dropping by your legislator's office. Probably one of the least commonly performed methods of advocacy is actually contacting your legislator. However, as we will get into the discussion, as recent events with the sustainable growth rate formula and its repeal, there have been a greater amount of direct communications between constituents, surgeons who are constituents, and then their elected officials. There are also other additional ways of carrying out advocacy, as I've just addressed, and testifying could be one of them, as we see one of our former Surgeon Generals, C.Ever Koop, testifying here. It may lead to legislation that carries out and addresses issues that affect both us and our patients. One important aspect about advocacy and about legislation is rendered by Otto von Bismarck almost 100 years ago. And obviously you can read his quote here, and it obviously rings true. And this is one of the things that makes people uncomfortable with regard to legislation. There are aspects of the process that are, as surgeons, frustrating, because obviously on almost all of our application processes, whether it be for medical school or surgical residency or or even further into fellowship, we all identify an action and a relative immediate reaction to that action. Our surgical technique is connected to an outcome. And unfortunately, a visit to an elected official doesn't necessarily lead to an immediate action. It requires a more insidious approach. You have to develop a relationship over a long period of time before you can eventually lead to results, unless, of course, it is a large group of people all acting at once in a form of a Lewesa type of solidarity effect, like in Poland many years ago, where there is an immediate reaction because there's no alternative but to react in that way. So why is it important? And this is probably obviously the most important question that a person has to ask themselves if they're going to start to participate in advocacy. You need to be able to understand why it's important. And so it is our responsibility, and of course you can say things similarly about jury duty that everybody tries to get around, but it will impact you whether you want it to or not. It will impact our ability to care for our patients. It will impact our patients irregardless of our ability to care for them. And so it is important to impact what we do in the operating room by way of advocating on behalf of certain legislation. In addition, health policy is one of the most hotly debated topics, and so it is commonly discussed with legislatures. They're very familiar with the issues because they frequently involve finance, and finance is one of the most important aspects with regard to how the government works. So why would it be important for you as a surgeon to be an advocate? Well, you bring a specific viewpoint that others can't bring. The legislators like to hear from surgeons because there is a relatively pragmatic approach, there is a no-nonsense approach, and you bring a viewpoint of a person who's working in the trenches, who's caring for patients, whether you yourself as the constituent voting for that person, or for example, if you happen to work at a hospital that's outside of your own district, you care for constituents within the district of the legislative official. And so it's possible that you could discuss these issues with more than one legislator at each level of your legislative world. It could be a city councilor, it could be a city councilor in the city next to you because that's where your hospital is. It could be your state representative, or it could be your state senator, and then of course it goes up from there to the federal representatives, our congresspeople in Washington, D.C., and our senators in Washington, D.C. All of those people you can discuss both on behalf of yourself and on behalf of your patients. One of the first advocacy events I went to before I was the converted showed a similar slide that reflects how you become an important advocate, or why it's important to be an advocate. And so it may not be easy to see from the back of the room here, but I can tell you, I'll start at the bottom, and what it says outside of this, incidentally, this pyramid, for discussion's sake, represents approximately 750,000 people. That is about the size of most congressional districts. They are created in such a way based upon the census to give that population. Obviously, as the population of the United States goes up, without adding Congress people, the amount of people within each district will go up, but it's about 750,000 people. And so the first thing that a person has to do to weigh in and be an advocate is they have to be a registered voter. And right away, 20% of people are not eligible to register to vote. And then next, another 20% don't register to vote. So of those 750,000 people, already you're down to 60% of people that would even register to vote. Then, of course, of that, only half of that actually vote, right, of all of our registered voters. And so you're down now to about 30% of that. And so of that, only 1% donate money. And of that, you have to remember that in general, the rules require that if you don't donate $200 or more, your name will not be put down on the list of people who donated to that particular legislator's campaign during this campaign cycle. So if you donated 2 years ago, that's erased. But if you donate during this campaign cycle, your name will be on a list. And if your name is on the list, well, then they will know who you are, or they will recognize you as an individual who cares about your community, who cares about this individual who's in office, and they will listen to you potentially with a more interested ear. And then finally, the pinnacle, of course, would be people who actually volunteer for that candidate's campaign or get more involved with the campaign process or discuss relatively regularly with that legislator or their legislative aides issues that impact your practice, your health, your livelihood, and the patients that you care for. So examples of advocacy and why advocacy is important. Clearly, all of the members of SAGES should have received Dr. Brunt's email earlier this week that identified that the sustainable growth rate formula that was passed in 1997 has been repealed. That, in large portion, happened because of massive grassroots events or efforts on behalf of surgical associations. I'm certain those of you who are members of the College of Surgeons recognize the number of emails that were sent to you on behalf of Dr. Warshaw urging you to advocate, to call your elected officials to support this particular legislation. And it was successful. You could argue that the legislation was going to pass, but what made us feel as if the grassroots were more successful is the way in which it passed. It didn't pass by a 51 to 49% vote. It passed in landslide fashion. And so it clearly demonstrated that people were listening and that it was time to try to prevent this annual process or semi-annual process of the potential for Medicare reducing our reimbursement by as much as 30% at one time, and the most recent was 21%. In my own state of Indiana, we had a similar circumstance, so it doesn't have to be a federal law. Indiana has a relatively favorable malpractice environment, and as I've done to members of my own committee, I will speak on behalf of the state of Indiana, how favorable it is to practice in the state because of that. We had a governor in the 1970s who is a primary care physician, and similar to the malpractice issues of a decade ago where people or physicians were leaving the states of Florida, West Virginia, Mississippi, Pennsylvania in droves because of the risks of malpractice litigation. The similar thing was happening in the late 1960s and 1970s because there were no insurers to provide liability insurance. You couldn't find one. It wasn't that it was even too expensive. There just wasn't an insurer to provide it. And so what they enacted at that time was a very nice malpractice act that includes a physician panel that weighs in on, and the decision that they weigh in is admissible in court. Although the case can be taken to court without the panel's action necessarily deciding if it can or can't go to court, that news or that decision can be admissible in court, and we can be called as expert witnesses if you are on the expert panel to weigh in as well as a member of the trial. And so there were a couple of bills that were coming through this year that would change our cap, that would increase the current cap of $1.25 million to $1.65 million. That actually was an effort to try to avoid a cap of $2 million, which was some of the initial estimates that it would go up to. And then there was another bill in the other chamber that would increase the minimum claim that would avoid the three-person panel process. So a larger percentage of malpractice claims or malpractice cases could go through without the available benefit of physician experts reviewing the case and determining if it had merit or it did not have merit. And in large part, because of similar grassroots advocacy that occurred with the SGR, we were able to initially delay the vote and then eventually lead what was initially felt to be something that would be carried through and would be enacted to something that was actually voted down. And so it was in large part by physician groups, surgeons, as well as the State Medical Association that led to this effort. And so what you can see with those two efforts is that grassroots advocacy and being an advocate, even though as an individual you can't potentially sway efforts without a lot of effort on your part, it can work together in large groups, or if you're willing to make the effort over a longer period of time and you gain the confidence of your elected official and they recognize who you are, you can also impact things that impact you in the operating room and how you care for your patients. And with that, I will cede the platform to my colleague, Dr. Goldberg, who will talk to us about how to be a better advocate.